be focusing in particular on the challenges of diagnosing rare diseases. Patients with rare diseases must often wait for years for a diagnosis. A quarter of patients wait over 4 years, while an unbelievable 50% of patients must live with no accurate diagnosis. Living without a diagnosis can impact a patient's physical, mental, and emotional well-being, while receiving an accurate diagnosis can allow a patient and their family to move forward with a focus on managing future challenges.
Nice. So for a lot of rare diseases, it takes a while of seeing doctors and sort of looking for answers before it's realized that something more complicated or something more rare is going on that needs further investigation.
Some start prenatally, and you see already during pregnancy that indeed something does not go. Other will start just very early on. Other, like Friedreich ataxia, for instance, will start between 7 and 10, 12. And other will start even later. So there's no rule. It depends really on each disease. Each disease is specific.
Yeah, we certainly have experience with families that have a child who has a particular disorder and they don't know what the disorder is. And when this first comes to light, they pursue a diagnosis very aggressively, and sometimes for a year or 2 years or 3 years or so. But then they begin to accept the diagnosis, the fact that there's no diagnosis, and they fall off and don't pursue it for a while. And then sometimes 5, 10 years later or so, they see something on TV or they read the paper or something, and they find out that genetics has really come a long way. And then there's a recrudescence of interest in that. And we get a lot of families that have had that history of, let's say, a hiatus in pursuit.
There has been an extraordinary improvement in genetic diagnosis in the past 10 years. And often I see families that say, yeah, but my son has been tested. There was a genetic test 10 years ago, and it was negative. But that doesn't mean that if you redo it now, even if it was done 5 years ago, and depending which test. So a negative test is a negative test for the type of assay that was used at the time of a certain knowledge. And the knowledge is changing every month.
That diagnosis is a cornerstone of medicine. This is what we do. It's part of what we do. This is what doctors and physicians and allied health providers, this is what we're all working towards, is diagnosis. It should be no different if you have a rare disease.